This first slide is an image that depicts the differences between a normal healthy cell on the left versus a cell that has developed mutations or gene alterations, DNA translocations, as Dr. von Maren mentioned. And these cells grow radically, and they do not have the typical cell growth and death cycle. Each treatment that was discussed, whether it be chemotherapy, which is systemic and can affect the normal cells of the body as well as targeting the cancer cells, targeted therapy, immunotherapy, or a combination of any of these types of drugs, each comes with potential side effects. It was difficult to discuss each individual medication regimen and their potential side effects. Many of them cross. So I'll be covering the 6 side effects that I zero in when assessing patients in our outpatient clinic. Nausea and vomiting. That's that uncomfortable feeling you get that keeps you from wanting to eat or drink, or the concern that you have that if you do eat or drink that you'll vomit and expel the food or fluid. I always ask our patients to keep a journal about when the nausea occurs. Is it a nausea that occurs prior to your treatment, perhaps on the way to the hospital, during the treatment? Those are called an anticipatory nausea. Or does that nausea or vomiting occur during the treatment or within the 24 hours of treatment? Or there are even some that do not develop nausea vomiting until days after, more than 24 hours after the treatment. Knowing when your nausea occurs is helpful because we can pick a regimen for you, whether it be pre-medication prior to coming in for your treatment, pre-medication during your treatment, or medication that you could use for home use. 2 medications we use, compazine and Zofran, usually the first line of antiemetics that are given, but are they working? And if not, there are several other regimens that we can choose if we know your particular cycle. Some recommendations to drink fluids through the day. It's very important to maintain your fluid intake. And if your nausea and vomiting medicine is keeping you from eating or drinking, we need to know that immediately. Any side effect that affects your nutritional status is crucial for us to know. Some other suggestions are to eat drier foods, crackers, toast. Avoid strong odors. Sucking on hard candy, popsicles, anything that you enjoy, and also following your antiemetic regimen. Fatigue is another difficult side effect of treatment. But we're also interested in what is causing your fatigue. Is it just in general related to the treatment? Which days of your cycle are the most troublesome for fatigue? Does it keep you from getting out of bed? Does it keep you from eating or drinking because you're so tired and sleeping? And what are other factors that could be affecting your fatigue? For example, any emotional factors such as anxiety or depression. Financial worries. Do you have insomnia related to your treatment? Many regimens require the use of a steroid, dexamethasone, for example, and steroids can cause hyperactivity, keep you awake. We also look at your blood count frequently. 2 tests that are done routinely are CBC, or a complete blood count. Some of the results that we're looking for are your hemoglobin and your hematocrit. Hemoglobin carries oxygen in your blood. If your hemoglobin is low and you are anemic, or known as anemic, this can also cause fatigue. And your electrolytes, which are found in a comprehensive metabolic panel, check your electrolyte levels and some vitamin levels. Is it related, is your treatment, one of the side effects of your treatment affecting electrolyte or vitamins? Also your iron level. This may also be checked as a cause for your fatigue. Know that at all centers you have, and particularly at Fox Chase, we have a wonderful social service department that helps our folks manage any issues that they may have, treatment issues, whether it be emotional or financial concerns. Some interventions for fatigue: to keep moving. That sounds odd. How can I keep moving if I'm so tired? But it is very important to keep moving. Take time to relax and nap if you need it, but limit your nap time so that at night you can sleep better and longer. Eat as well as you can and drink plenty of fluids. And we also recommend joining a support group to help you to cope and to learn from other people how to manage your fatigue. Diarrhea is a side effect that can wreak havoc with the body, affecting fluid and electrolyte levels and adding to that feeling of fatigue. And it contributes greatly to dehydration, affecting your overall feeling of poor health. For diarrhea, I encourage you not to wait. Diarrhea is defined as watery stools. If you find that your diarrhea occurs 3 to 5 times in a day, I encourage you to call your center and make your medical oncologist aware immediately. Or if you are receiving radiation therapy, to let your radiation oncologist know as well. Even an unformed stool, something that's mushy, that affects your ability to leave the house, or if at any time you become incontinent of stool, which you're not able to control the output, that is something that you need to call immediately. We encourage you to drink plenty of fluids, to eat a bland, low-fiber diet, and avoid greasy, fatty foods. Also, raw fruits and vegetables can add to the way or the quickness that your food goes through your intestinal tract. We also can give you some information about antidiarrheal medications, whether they're over-the-counter or whether they're prescription. When you call in, nurses are also going to be asking you about what medications you're on. Are you taking stool softeners, laxatives, or fiber supplements? These things in combination may be contributing to your diarrhea. When diarrhea is severe, you also may want to consider a product to protect the skin near your anus, such as Desitin or Balmex. On the other hand, we have constipation. Some of our regimens cause constipation. Constipation is not just a lack of stool for a day or 2 or 3. It can also be a stool that you pass daily, but it's very hard to pass, or perhaps you feel as if you haven't eliminated completely. There are several medications that can be used, along with some more organic methods like increasing your fluid, increasing your activity, increasing fiber. Some stool softeners and laxatives can also be added for those regimens that make it particularly difficult for you to pass stool, or if you're taking pain medication, that can also contribute to constipation. Colace is a stool softener that can be purchased over the counter. There is Dulcolox. There's also Senecot S, which is a combination of stool softener and laxative that we have as part of our constipation regimen here at Fox Chase. Mouth sores and or pain in your mouth. So you may have pain in the oral membranes of your mouth without a sore, or you may also have sores, maybe one or many, that can be very painful. These sores can affect your desire to eat or drink. Some families, patients also describe it as feeling as if they're swallowing glass. We're particularly concerned, again, with any side effect that affects your nutritional status, your fluid intake, and it's something that we ask that you notify your medical oncologist immediately. Some interventions I have listed are to brush your teeth gently with a soft bristle brush. So even though you may not want to touch your mucous membranes of your mouth, your gums, or your teeth, oral hygiene is still important, particularly when you're having treatment, because the changes that those cells in your mouth go through during treatment. Avoid alcohol-based mouthwash. There's a recipe on this slide that is a rinse and gargle with a half teaspoon of salt and a half teaspoon of baking soda in a cup of water. That is a very effective rinse to help keep your mouth clean after a gentle brushing. Even if you're not able to brush, I do encourage you to consider this rinse to keep your mouth clean. Also, removing dentures. If you're a denture wearer, take them out periodically. Take a look in your mouth. If the skin in your mouth is sensitive, wearing your dentures for long periods of time may cause some rubbing. And also avoiding acidic, spicy, salty, coarse foods like hard pretzels and or dry foods. We have a preparation. It is a prescription. It's called a magic mouthwash. It is known by other names in other facilities, but it has a lidocaine base to it that can numb the mucous membrane. If not just periodically, so that you can get in your food and fluids for that meal. The last side effect is skin. Some treatments can cause changes to the skin, including the nails, darkening the nails, or causing the fingernails or toenails to peel. It can cause red rashes like sunburn or blistering on the hands or the feet. Always call when any of these situations arise. Rashes may be a result of a medication that you're taking, and we should know immediately so that it can be attended to, whether the dose be held or some other intervention provided for the rash. I'd like to just close with the importance of journaling. This is really the most important thing, to keep a journal of your side effects of your treatment. As you know, one day goes into the next, and very often you forget which day it was that you were bothered by a particular symptom. Being able to have that on paper and share during your meeting, your clinic visit with your physician is very important. There can be some preventative or proactive interventions that can be placed instead of just being reactive to a situation or a side effect. And just remember, you are your best advocate.